Hello guys, welcome back to my YouTube channel. Guys, if you're watching this video for the first time, please click that subscription button, and if you are a returning subscriber, thank you very much. Don't worry, I am on my big haul. Don't worry about it. Guys, today I want to talk about ulcer. Nowadays, you get that a lot of people are suffering from ulcer. And today, I want to tell you what are the causes of ulcer, how can you know that you have ulcer, and how can you manage ulcer, and what are the food you should avoid eating when you have ulcer, and what are the food you're supposed to eat for you to prevent getting ulcer. Let's get into the video. What are these causes of ulcer? We have some of the causes of ulcer. Number one is the bacteria itself, which is called H. pylori or Helicobacter pylori. This is the bacteria that most of the time usually cause ulcer. Number two, those who are using NSAID drugs, some of the painkillers. Some of these painkillers, prolonged use of them can cause ulcer. Like example of one of the painkiller that can cause ulcer is brufen. Brufen, if you use it prolonged, you are predisposing yourself from ulcer, or you are likely to get ulcer in the long run. Another thing that usually causes ulcer is stress. If you have that person, usually something small can put you at stress, you are likely to get ulcer. And the last one is alcohol. Those who are drinking alcohol, whether you like it or not, at one point you will suffer from ulcer. I've also forgotten to tell you that some types of food can cause ulcer, and also starving a lot can cause ulcer. Those are some of the causes of ulcer that I know. Starving, stress, sometimes types of food, alcohol, some types of drugs like NSAID drugs, and the bacteria itself, H. pylori. Those are some of the things that usually cause ulcer. We usually have two different types of ulcer, and that is gastric ulcer and the duodenal ulcer. Gastric ulcer usually affect the lining of the stomach, and the duodenal ulcer usually affect the upper small intestine. And ulcer is just a source in the lining of the stomach. Those are the types of ulcer, the gastric and the duodenal ulcer. Those are the types of ulcers that most of the people usually suffer from. And you get that most of the people usually have ulcer and they don't know, or they wait until it is worse because they don't know some signs and symptoms of ulcer. And you get that when it is worse, it is always difficult to treat. So what are these signs and symptoms of ulcer? Number one, it's heartburn. Heartburn is an obvious one, and if you experience a lot of heartburn without even eating any, as in you sometimes during the day or in the morning you get a lot of heartburn, in the long run of the day maybe you might having ulcer, so you should go and check if you are having ulcer. Another sign is abdominal discomfort. If you are having ulcer, sometimes you can have abdominal pain, you can have diarrhea, you can have balloting or passing a lot of gas, and also you can have chest pain or the upper abdominal pain, especially if you are having duodenal ulcer. So ulcer is also dangerous, and it can cause some of the complication. And when you have ulcer, you should take care of yourself and you should treat it as fast as possible. Number one, you can have GIT bleeding, Number two, you can have perforation in the stomach or in the lining of the stomach or in the abdomen. Number three, ulcer itself can turn into cancer. And number four, you can have what? You can have constant abdominal pain. So the next thing that I'm going to talk about is how do we treat ulcer and what are types of the food that you're supposed to eat when you are having ulcer, and what are the types of food you are supposed to avoid when you have ulcer. So ulcer, because most of the time it is usually caused by the bacteria, you will get that we will treat it with antibiotics, the antacid, the analgesics, and the antidiarrheal, because sometimes you get that somebody, when you have ulcer, you have abdominal disturbance and you can suffer from diarrhea. And then we can also treat it with proton pump inhibitors. And also you can manage your diet. And what are now, that will take me to what types of food you're supposed to eat when you have ulcer, and what types of food you're supposed to avoid when you have ulcers. So the food that you're supposed to avoid when you have ulcers is alcohol. Alcohol is a food. It's food. I don't know, but you're supposed to avoid alcohol because it will continue burning the lining of the stomach. You're supposed to avoid drinking milk when you have ulcers. You're supposed to avoid taking tomato. Tomato usually have acids, and you're supposed to avoid it. They usually say that the peels of the tomato is the one that have the acid. So when you are eating it, you can remove the peels. The peels, you can peel it. You can peel the tomato and you eat it that way. You cook with food the way it is, and then also you can avoid eating the what lemon. Some people usually take lemon as a detox, and when you have ulcer, please consider taking other things apart from lemon. You can also avoid taking oranges and any other food that contain acid. You should avoid. And what are the food that you're supposed to eat when you have when you have ulcer? So when you have ulcer, you can eat carrots. You can eat, and let me say, you can eat any food that doesn't have an acid. You can eat spinach. You can eat some of the kales that doesn't have the acid. You can eat cabbages, apple, carrot. You can eat anything that doesn't have the acid for you not to get the attack, the abdominal pain, the heartburns, and the other attacks. I think that is what you are supposed to know about ulcers. And let's meet in my next video.